لتؤمنوا بالله ورسوله وتعزروه وتوقروه وتسبحوه بكرة وأصيلا. إن الذين يبايعونك إنما يبايعون الله يد الله فوق أيديهم فمن نكث فإنما ينكث على نفسه ومن أوفى بما عهد عليه الله فسيؤتيه أجرا عظيما. سيقول لك المخلفون من الأعراب شغلتنا أموالنا وأهلنا فاستغفر لنا. يقولون بألسنتهم ما ليس في قلوبهم قل فمن يملك لكم من الله شيئا إن أراد بكم ضرا أو أراد بكم نفعا بل كان الله بما تعملون خبيرا. بل ظننتم أن ينقلب الرسول والمؤمنون إلى أهلهم أبدا وزين ذلك في قلوبكم وظننتم ظن السوء وكنتم قوما بورا. ومن لم يؤمن بالله ورسوله فإنا أعتدنا للكافرين سعيرا. ولله ملك السماوات والأرض يغفر لمن يشاء ويعذب من يشاء وكان الله غفورا رحيما. سيقول المخلفون إذا انطلقتم إلى مغانم لتأخذوها ذرونا نتبعكم يريدون أن يبدلوا كلام الله قل لن تتبعونا كذلكم قال الله من قبل فسيقولون بل تحسدوننا بل كانوا لا يفقهون إلا قليلا. قل للمخلفين من الأعراب ستدعون إلى قوم أولي بأس شديد تقاتلونهم أو يسلمون فإن تطيعوا يؤتكم الله أجرا حسنا وإن تتولوا كما توليتم من قبل يعذبكم عذابا أليما. ليس على الأعمى للمخلفين من الأعراب ما حرجوا ولا على الأعرج حرج ولا على المريض حرج ومن يطع الله ورسوله يدخله جنات تجري من تحتها الأنهار ومن يتولى يعذبه عذابا أليما. لقد رضي الله عن المؤمنين إذ يبايعونك تحت الشجرة فعلم ما في قلوبهم فأنزل السكينة عليهم وأثابهم فتحا قريبا ومغانم كثيرة يأخذونها وكان الله عزيزا حكيما. وعدكم الله مغانم كثيرة تأخذونها فعجل لكم هذه وكف أيدي الناس عنكم ولتكون آية للمؤمنين ويهديكم صراطا مستقيما. وأخرى لم تقدروا عليها قد أحاط الله بها وكان الله على كل شيء قديرا. ولو قاتلكم الذين كفروا لولوا الأدبار ثم لا يجدون وليا ولا نصيرا. سنة الله التي قد خلت من قبل ولن تجد لسنة الله تبديلا. وهو الذي كف أيديهم عنكم وأيديكم عنهم ببطن مكة من بعد أن أظفركم عليهم وكان الله بما تعملون بصيرا. هم الذين كفروا وصدوكم عن المسجد الحرام والهدي معكوفا أن يبلغ محله ولولا رجال مؤمنون ونساء مؤمنات لم تعلموهم أن تطؤوهم فتصيبكم منهم معرة بغير علم ليدخل الله في رحمته من يشاء لو تزيلوا لعذبنا الذين كفروا منهم عذابا أليما إذ جعل الذين كفروا في قلوبهم الحمية حمية الجاهلية فأنزل الله سكينته على رسوله وعلى المؤمنين وألزمهم كلمة التقوى وكانوا أحق بها وأهلها وكان الله بكل شيء عليما. لقد صدق الله رسوله الرؤيا بالحق لتدخلن المسجد الحرام إن شاء الله آمنين محلقين رؤوسكم ومقصرين لا تخافون فعلم ما لم تعلموا فجعل من دون ذلك فتحا قريبا والذي أرسل رسوله بالهدى ودين الحق ليظهره على الدين كله وكفى بالله شهيدا. محمد رسول الله والذين معه أشداء على الكفار رحماء بينهم تراهم ركعا سجدا يبتغون فضلا من الله ورضوانا سيماهم في وجوههم السجود ذلك مثلهم في التوراة ومثلهم في الإنجيل كزرع أخرج شطأه فاستغلظ فاستوى على سوقه يعجب الزراع ليغيظ بهم الكفار وعد الله الذين آمنوا وعملوا الصالحات منهم مغفرة وأجرا عظيما.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome again, everyone. Inshallah, we listened to another version of the recitation, and we were going to do a bit introduction, just taking us back to COVID-19 updates, see the vaccines, and see how we can talk through it to all of us. Then our teacher will be joining us afterwards for the Quran Arabic sections. And one interesting episode we're going to have today is about people that are trying to start learning the Quran. So we're going to have an introduction into the alphabet. So we're going to have a separate class for adults learning the Quran from beginning, inshallah. So in the next 5 minutes, let us listen more to the Quran recitation. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
إنا فتحنا لك فتحا مبينا ليغفر لك الله ما تقدم من ذنبك وما تأخر ويتم نعمته عليك ويهديك صراطا مستقيما وينصرك الله نصرا عزيزا والذي أنزل السكينة في قلوب المؤمنين ليزدادوا إيمانا مع إيمانهم ولله جنود السماوات والأرض وكان الله عليما حكيما. ليدخل المؤمنين والمؤمنات جنات تجري من تحتها الأنهار خالدين فيها ويكفر عنهم سيئاتهم وكان ذلك عند الله فوزا عظيما ويعذب المنافقين والمنافقات والمشركين والمشركات الظانين بالله ظن السوء عليهم دائرة السوء وغضب الله عليهم ولعنهم وأعد لهم جهنم وساءت مصيرا ولله جنود السماوات والأرض وكان الله عزيزا حكيما إنا أرسلناك شاهدا ومبشرا ونذيرا لتؤمنوا بالله ورسوله وتعزروه وتوقروه وتسبحوه بكرة وأصيلا إن الذين يبايعونك إنما يبايعون الله يد الله فوق أيديهم فمن نكث فإنما ينكث على نفسه ومن أوفى بما عاهد عليه الله فسيؤتيه أجرا عظيما سيقول لك المخلفون من الأعراب شغلتنا أموالنا وأهلنا فاستغفر لنا يقولون بألسنتهم ما ليس في قلوبهم قل فمن يملك لكم من الله شيئا إن أراد بكم ضرا أو أراد بكم نفعا بل كان الله بما تعملون خبيرا بل ظننتم أن لن ينقلب الرسول والمؤمنون إلى أهليهم أبدا وزين ذلك في قلوبكم وظننتم ظن السوء وكنتم قوما بورا ومن لم يؤمن بالله ورسوله فإنا أعتدنا للكافرين سعيرا ولله ملك السماوات والأرض يغفر لمن يشاء ويعذب من يشاء وكان الله غفورا رحيما سيقول المخلفون إذا انطلقتم إلى مغانم لتأخذوها ذرونا نتبعكم يريدون أن يبدلوا كلام الله قل لن تتبعونا كذلكم قال الله من قبل فسيقولون بل تحسدوننا بل كانوا لا يفقهون إلا قليلا قل للمخلفين من الأعراب ستدعون إلى قوم أولي بأس شديد تقاتلونهم أو يسلمون فإن تطيعوا يؤتكم الله أجرا حسنا وإن تتولوا كما توليتم من قبل يعذبكم عذابا أليما ليس على الأعمى حرج ولا على الأعرج حرج ولا على المريض حرج ومن يطع الله ورسوله يدخله جنات تجري من تحتها الأنهار ومن يتولى يعذبه عذابا أليما لقد رضي الله عن المؤمنين إذ يبايعونك تحت الشجرة فعلم ما في قلوبهم فأنزل السكينة عليهم وأثابهم فتحا قريبا ومغانم كثيرة يأخذونها وكان الله عزيزا حكيما وعدكم الله مغانم كثيرة تأخذونها فعجل لكم هذه وكف أيدي الناس عنكم ولتكون آية للمؤمنين ويهديكم صراطا مستقيما وأخرى لم تقدروا عليها قد أحاط الله بها وكان الله على كل شيء قديرا ولو قاتلكم الذين كفروا لولوا الأدبار ثم لا يجدون وليا ولا نصيرا الله التي قد خلت من قبل ولن تجد لسنة الله تبديلا وهو الذي كف أيديهم عنكم وأيديكم عنهم ببطن مكة من بعد أن أظفركم عليهم وكان الله بما تعملون بصيرا هم الذين كفروا وصدوكم عن المسجد الحرام والهدي معكوفا أن يبلغ محله ولولا رجال مؤمنون ونساء مؤمنات لم تعلموهم أن تطؤوهم فتصيبكم منهم معرة بغير علم ليدخل الله في رحمته من يشاء لو تزيلوا لعذبنا الذين كفروا منهم عذابا أليما إذ جعل الذين كفروا في قلوبهم الحمية حمية الجاهلية فأنزل الله سكينته على رسوله وعلى المؤمنين وألزمهم كلمة التقوى وكانوا أحق بها وأهلها وكان الله بكل شيء عليما لقد صدق الله رسوله الرؤيا بالحق لتدخلن المسجد الحرام إن شاء الله آمنين محلقين رؤوسكم ومقصرين لا تخافون فعلم ما لم تعلموا فجعل من دون ذلك فتحا قريبا والذي أرسل رسوله بالهدى ودين الحق ليظهره على الدين كله وكفى بالله شهيدا محمد رسول الله والذين معه أشداء على الكفار رحماء بينهم تراهم ركعا سجدا يبتغون فضلا من الله ورضوانا سيماهم في وجوههم من أثر السجود ذلك مثلهم في التوراة ومثلهم في الإنجيل كزرع أخرج شطأه فاستغلظ فاستوى على سوقه يعجب الزراع ليغيظ بهم الكفار وعد الله الذين آمنوا وعملوا الصالحات منهم مغفرة وأجرا عظيما.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Assalamu alaikum wa rahmatullahi wa barakatuh. Now, good morning everyone. Ekaro.
Alaikum.
Alaikum assalam everyone. And because of the COVID-19 vaccine, so for the first few minutes, let's just have a few talk about the COVID-19. Now, we'll be looking into for some of us that have that have an access into the leaflet of the Public Health England Guide for Adults. So it would be good for us to go through that. I think I've sent that one earlier to every one of us today. So it would be good for us to have a look and talk about who can take these vaccines. And what we've sent some leaflet and some WhatsApp information from BIMA, British Islamic Medical Association, stand on the vaccination. But still, it's good for us to, So it's good for us to, as much as possible, it's good for us again to discuss and just talk through it in case there's so many other things that we need to talk about. And this is just for us to have an insight into exactly what the COVID-19 vaccine is all about, especially for adults. Some of us that have elderly patients and some of us that have people with allergies within our homes and families. So I'll just go through this. I know some of us have read it, but it's good for us to just go through all of those things. Okay, so the basic things that we need to know about this vaccine is that those people that can have these vaccines, one, the person should be an adult living or working in a care home for the elderly. So if you have, or you know, or you have family that is living or working in a care home for the elderly, it is advisable for them to take this vaccine as well. Then if you are a frontline healthcare worker, if you continuously work in the frontline team, I mean, you're working with COVID-19 patients, you are working with elderly patients, people that have comorbidities. So it's advisable for you to take this vaccine. Then number three, that if you're a frontline social worker, we know who social workers are. So this is advisable for us to take this vaccine as well. Then if you're a carer, working in domiciliary care, looking after older adults. So we know that in our community, especially in our community, some of us are working with elderly patients and we work with older adults in different home care. So it's advisable that we take these vaccines. Then if you are age 65 and over, so there's so many instructions in our GP practices within our homes on who should take these vaccines. So it's quite very important for us to look into it, read about it and ask questions. When we read, when we ask questions, this makes it easy for all of us to understand what is happening. And if you have younger adults that have long-term clinical conditions, we know what clinical conditions are. So it's advisable for us to have, for them to have this vaccine. Then this vaccine will also be offered to adults with conditions such as a blood cancer. What we're talking about is leukemia, lymphoma, and myeloma. Then people that have diabetes, adults, diabetes, dementia, heart problem, people that have chest and breathing difficulties, people with kidney disease, people with liver disease, people that have low immunity, people that have rheumatoid arthritis, people that have liver diseases, people that have organ transplant, people who have neurological condition, and people that have severe and profound learning disability. All of those people are indicated to have these vaccines. But one important thing that we have to look into, that we have mentioned names of so many people that should be able to take this vaccine, but who cannot have the vaccine. So the vaccine did not contain living organisms. So women of childbearing age, those who are pregnant, those who are planning to be pregnant, those who are breastfeeding, all of them should read the informations on COVID vaccination on the Public Health of England website. If they cannot read, they have to speak to their GP or their healthcare provider so that they can help out to explain to them what they have to do. And also, 1 minute, please. I just need to. Okay. So also what we advise is if we know of our families and elderly patients that are wishing to take this vaccine, we advise that they should please seek for more information before they take the vaccine. We encourage people to have informed decision. It's not as if they have been forced to take the vaccine, but they have informed decision, they have the decision they will need to be able to take the vaccines. So please, as much as possible, we should be able to educate ourselves, read leaflet, understand it before we make statement, before we say something, or before we advise other people. So this, with the vaccine have side effects. We know with medicines, there are so many side effects, depending on individual circumstances. The body system is different and we are different. So most of us react to medication, we react to medicine differently in these different ways. So it's important that with this vaccine as well, we look into the side effects. So like all medicines, vaccines can cause that side effect. Most of those are mild and short term, and not everyone gets them. But even if you do not have symptoms after the first dose, you still need to have the second dose. Although you may get some protection from the first dose, having the second dose will give you the best protection against the virus. So this is the way the vaccine is. After you take the first dose, then after a couple of days, you take another dose. But one thing that I need to stress out here is what are the very common side effects or people that have allergies. So if you have allergies, or you know that you have allergies, or you're not sure if you have allergies, or you have had allergies in the past, and you're not sure that it's going to come back again, please mention this to your health practitioner, your doctor, or your GP, just to be sure before you take the vaccines. So what are the very common side effects we're looking into? So you have having a painful, heavy feeling and tenderness in the arm where you have had your injection. Some of us have had vaccination as a child. We know that how we feel when we have vaccines. So this is tender. You have the tenderness, some heavy feelings at the site of the injection. And these tend to be worse around 1 to 2 days after the vaccine. They feel tired. Some people do have headache. There's a general body pain and there's a mild flu symptoms. So although feeling feverish is not uncommon for 2 to 3 days, a high temperature is unusual and may indicate you have COVID-19 or another infection. So you can rest and take the normal dose of paracetamol, follow the advice in the packaging to help you feel better. As we're saying, as much as possible, seek more information. So these are the first very few and common side effects that we can find in the Public Health of England COVID-19 vaccines. I'm still going to send out this leaflet out again later today so that we can read it. It contains so many things that we need to know. So people have not been first, but people have been educated on so many things what we need to know about the vaccination. And before we go again today, I'm going to go through the British Islamic Medical Association information decision about the vaccination as well. So these are the very, very common side effects that we look into. But if you do seek advice from the doctor, make sure you tell them about your vaccination history and what you have taken in the past, or if you have any other side effects from when you are younger or at any point in time of your life. So there's some other questions that we may have to answer, and to our family and friends and our organizations are people that have already taken the flu vaccination. So I have had flu vaccination. Do I need the COVID-19 vaccine as well? So the flu vaccine does not protect you from COVID-19. As you are eligible for both vaccines, you should have them both, but normally separated at least a week interval. For some of us, our elderly patient, or some of our elderly patient or families that have comorbidities like high blood pressure, cardiac problem, diabetes, some of them have already had the flu vaccination. But if you have had the flu vaccination and you wanted to have the COVID vaccine as well, there should be at least a week interval. So that is that with that. Then another thing that was said in this leaflet that we might have to look into and talk about is, can I catch COVID-19 from the vaccine? We know that so many people, there's so many things going around and so many information, but you cannot catch COVID-19 from the vaccine. But it is possible to have caught COVID-19 and not realize it after the symptoms until after your vaccination appointment. So the vaccine itself will not give you COVID-19, but it's possible you might have had it before then. So this might give you some symptoms that is related to COVID-19. But the most important symptoms of COVID-19 are recent onset of any of the following. 1, a new continuous cough, a high temperature, a loss of or change in your normal sense of taste or smell. So watch out for a new continuous cough, a high temperature, or a loss of or change in your normal sense or taste of smell. So if you have all those symptoms above, stay at home and arrange to have a test. We all know that we've been advised to have to isolate ourselves when we have symptoms. So stay at home, have a test, and let the authority know. So may Allah make it easy for all of us. So what do I do next? So after you have had the test, first dose, for those that are eligible to have the first dose. For those that are eligible to have the first dose, after you have had the first dose, you need to plan to attend your second appointment. So you should have a record card with your next appointment written on it for an appointment in 21 or 28 days. So wherever you are going, try as much as possible to have your card with you. So on this card, it is written in the card for your next appointment for 21 or 28 days. So it is important to have both doses of the vaccine to give the best protection if you are eligible to have the vaccines. Please read instructions and ask questions. So keep your card safe and make sure you keep your next appointment to get your second dose. So that is very, very important. And watch out for anaphylaxis. Watch out for side effects. Watch out for so many things that you feel is not normal within your system. If you have any side effect that you feel is not normal within your system, please, as much as possible, ring 111. So what should I do if I am not well when it is my next appointment? If you are unwell, it is better to wait until you have recovered to have your vaccine. But make sure you report this to your GP and your healthcare practitioner. But you should try to have it as soon as possible. You should not attend a vaccine appointment if you are self-isolated, waiting for a COVID-19 test, or unsure if you are fit and well. So listen, this is very important. So you should not attend a vaccine appointment if you are self-isolating, if you are waiting for a COVID-19 test, or if you are unsure or you are fit or unwell. So once you're not sure, please don't attend until you're well to be able to have one. Can I give COVID-19 to anyone after I have had the vaccine? The vaccine cannot give you COVID-19 infection, and 2 doses will reduce your chance of becoming seriously ill. So we do not yet know whether it will stop you from catching or passing on the virus. That is not well evidence now at the moment. So what we do, so it is important to follow the guidelines in your local area to protect those around you. To protect yourself and your family, friends and colleagues, you still need to, 1, practice social distancing. So it is still out there. The fact that this vaccination doesn't mean COVID has gone. No, we have to continue to practice social distancing. We have to wear a face mask. We have to wash our hands carefully and frequently, and we have to follow all the current guidelines. I'm going to repeat this again, that to protect yourself and your family, even after taking the vaccine and even when the vaccine is around, we have to still continue to practice social distancing. We have to continue to wear a face mask. We have to continue to wash our hands carefully and frequently, and we have to follow the current guidance. May Allah make it easy for all of us. And this information is contained in the Public Health of England COVID-19 vaccination for adults. So if there's any other questions or anything that we need to ask, please direct it to the right place. We should not just assume or give people false information because of our own personal feeling. So we should also remember that COVID-19 is spread through droplets, breathed out from the nose or mouth, particularly when speaking or coughing. So it can also be picked up by touching your eyes, nose, mouth after contact with contaminated objects and surfaces. Once again, COVID-19 is spread through droplets breathed out from the nose or mouth. So when kissing and things like that, particularly when speaking or coughing, it can also be picked up by touching your eyes, nose, and mouth after contact with contaminated objects and surfaces. And that is why they said we should continuously to wash our hands, and hands, which is much more very important to us. May Allah make it easy for every one of us. So this is a document that is, okay. So this is a document from the Public Health of England about vaccination. We have shared this through WhatsApp to everyone, and people have access to it. And if you go to Public Health of England website, if we can all Google it, we can read it and we can support our families, our friends, our people with this information. So this information today is just for us to have this informed decision of what is happening with this vaccine. Because over the last week, people are just saying so many things, but when there's evidence, there's information from the Public Health of England, then it will be good for us. It will be good for us to follow the guidelines. May Allah make it easy for all of us. But what should we pay attention to? What should we pay attention to? So we should pay our attention to who cannot have this vaccine. In our neighborhoods, in our families, with our friends, our society, the vaccines do not contain living organisms. The vaccines do not contain living organisms, so are safe for people with disorders of the immune system. These people may not respond so well to the vaccine, but a very small number of people who are at risk of COVID-19 cannot have the vaccine. Some people that are risks cannot still have the vaccine. So all instructions, all your past medical history, if you have so many history of so many things, maybe you've had allergies, serious allergies, anaphylaxis, side effects in the past, you have to let your healthcare professional knows about all this before you take the vaccines. So as much as possible, women of childbearing age, maybe people that are just married, people that are expecting to have a child, or even if you're not expecting to have a child, you are just that age that you can have a baby, please, you cannot have the vaccine. Then those who are pregnant, if you are pregnant or you're not even sure you're pregnant yet, you are not eligible to have the vaccine. Or you're planning pregnancy, maybe you're thinking of starting a family the next couple of years, few months, and you're thinking with your spouse, maybe you're planning to have it next year or in a couple of months, you want to have a baby, please, you can't have the vaccine. Or you are breastfeeding, you just had a baby and you're still breastfeeding over a year or two or more than 2 years. If you're still breastfeeding a child, you should not have the vaccine. All of this information you can find on the NHS UK website under COVID vaccination. It's also available under the Public Health of England website on vaccination. So all of these are very, very important things for us as Muslim that we have to really know. We have had that some people that have taken the vaccinations have had some side effects. We have had that some people that have taken vaccinations have had some side effects and they have reacted to the vaccination in some ways or the other. But at the same time, we should always watch out and read and follow the current guidance, follow the current informations. And if we are not sure and we're not happy about any information, please let us just ask. And we should not try to make up our own information so that we don't misguide people. And we know that as Muslims, we are women and we are family of knowledge. And Allah subhanahu wa ta'ala said we should not say anything. We should not confirm anything, and we should not infer anything until we're sure that this is the way it is and we have enough evidence for it. So before we make our own individual conclusion about the vaccine, we should be informed and we should know exactly what the vaccine is all about. And inshallah, before the end of the program, hopefully if there's any questions that I can take, we will take it. And I will share the British Islamic Medical Association stand. And after consultation with all scholars on COVID vaccine, we share this one online as well. So may Allah make it easy for all of us. So this is just the brief introduction I've got today with COVID-19. I just thought that it's better to talk about it. And then when we talk about things, some people were not good at reading in between lines, so we only listen to what people say. So which is why I decided to say, okay, let's do this first this morning. And with this little information, I hope that, alhamdulillah, inshallah, this will benefit us in this world and the year after. It will benefit our families, our friends regarding the vaccines. And inshallah, may Allah continue to protect us all, the vaccine and anything that is not vaccines. We are Muslim, we pray, and at the same time, we have to follow instruction. That is the instruction from for Islam as well. So may Allah make it easy for all of us. I can see that our tutor Arabic is here. May Allah continue to protect him. May Allah continue to be with him. May Allah continue to make his affairs easy for all of us. Thank you very much for listening this morning. As I said, all of the things I've said this morning are under NHS/COVID vaccination and under Public Health of England's information for adult COVID-19 vaccination. Assalamu alaikum wa rahmatullah. Subhanaka Allahumma wa bihamdik. Ashhadu an la ilaha illa anta wa nastaghfiruka wa atubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh, brothers and sisters.
Wa alaikum assalam wa
Alaikum
rahmatullahi
salam wa rahmatullahi wa barakatuh. Jazakillah khairan, Hajia, for that very beneficial and informative talk. Inshallah, for those that would like to ask a few questions, we will try and address that at the end of the program. So we would like to welcome our Sheikh, the Arabic teacher, to the platform, Sheikh Mahmud Danjumah Musa, who has been, kindly giving us his time and carrying us along with the Quranic Arabic series for the last, I think, 5 or 6 weeks now. May Allah continue to increase in Imam. So without further ado, Sheikh, when you're ready, please do go ahead. So you have an hour, 20 minutes, inshallah, for both the class as well as the question and answer.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa
rahmatullahi wa barakatuh.
كيف أنتم؟ كيف أنتم؟
Alhamdulillah.
Alhamdulillah, alhamdulillah. How are you?
بخير والحمد لله.
بخير.
So alhamdulillah rabbil alameen wassalatu wassalamu ala ashraf al-mursalin sayyidina wa habibina wa uswatina wa qudwatina wa maulana Muhammad wa ala alihi at-tayyibin wa ashabihi al-mubarakin wa alayna ma'ahum ajma'in ila yawmiddin. Amma ba'du, fassalamu alaykum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
I'm very, very sorry for coming late behind the schedule this morning. Thanks for having me here, and sorry once again for. I thought last week we talked about at-takhatub. We are still on at-takhatub, conversation. That's conversation. The essence of any language is to converse, to express your feeling, and for your feeling to be understood. The person you are conversing with needs to understand your language too. If you are conversing with someone who does not understand your language, communication cannot take place. Effective communication cannot take place. And at times you can communicate without using a voice, sound language. You can use signal as language. You can use symbol as language. But the best form of language is the sound language with which we are cruising. We have been cruising since 5 weeks ago, or more than that, but officially 5 weeks. So last week, who can remind me of what we talked about last week?
We talk about
Don't let us forget the rule. If you want to answer, just raise up your hand, signify, and I'll call your name. Hello, assalamu alaikum.
Alaikum salam.
Who can remind us of what we talked about last week? Just little of it. Okay, Adetutu.
We talk about Ismu, Al-Ismu. Ismu, we talk about Akwi. My brother, Akwi.
Brother.
Your brother. And my brother.
Yes.
She's my sister.
What is the Arabic? As you are giving us the English equivalent, also give us the Arabic equivalent to be sure that we are getting it.
Here. Ukti.
She's my sister.
Moisni. What's your name? Moisni.
Masmuk.
Musmuk. Ismuki. Moibat.
Ismuki. What's the meaning of Ismuki?
Ismuki. What is your name?
there is something missing there. The word what is missing.
What?
What?
Your is for female.
Masmuki means what is your name?
Yeah.
That ma stands for what? Ma. This ma stands for what? Don't let us forget. Okay.
Yeah.
Go on.
Ma usmiki Muiba. My name is
Muhibba.
Muiba.
Okay. My name is Muhibba.
Yeah.
What other thing can you remember?
To talk about Anna, I am.
Okay, someone is raising up. Okay, Alaja Adetutu, thank you. Alaja Bello.
Now we talk about Anna, like Anna, Nigeria.
Okay. Meaning?
I am a Nigerian.
Okay. And
we said man is like who?
Yes.
Who?
Yes.
So if we want to ask somebody, we can say Ma Ismuki. That's a lady.
A lady, yeah.
And we also talk about Jaat.
Jaha.
Yes.
Jaat.
Yes.
Jaat is Jaat. Jaat is for a female.
Yes.
Jaat Zainab. And we talk about Zahaba.
Zahaba, yes.
Zahaba means he came.
Yes.
And we talk about he. Hua.
Okay.
Hua is he.
Yes.
And who? Here.
Yes.
Here is a female.
Yes.
A lady.
Yes.
No.
Oh, for Alaja Adetutu and Alaja Bello, let us say louder takbir.
Allahu
Akbar.
Do we all agree with what both of them said?
Yes,
hello.
we do. Yes, we agree.
We agree. Thank you. Let's move on. Today we'll talk about, I will provide you with some words that we use in our daily conversation. Using the previous lessons to make them sentence. I'll give you some words and some noun and verbs. You'll now be using the previous knowledge you had to make them a meaningful sentence or meaningful sentences. Let's move on. For example, I want to talk about al-faslu.
Okay, so you're not doing the one which was the headphones again. Anyway, so what I plan to do is I'm going to Harold. I'm going to Harold for and
Assalamu alaikum.
Wa alaikum.
Alaikum salam.
Can we pronounce this?
Al-Fasl.
You can't see it well.
Disclaimer.
Al-Fasl.
Okay.
Al-Fasl.
Okay. What about this?
Al-Mat'a.
Again, check it very well.
Al-Mat'bahu.
Al what?
Al-Mat'bahu.
Al-Matbaha.
Al-Mat'bahu.
Al-Matbahu.
Al-Mat'bahu.
Al-Matbahu.
Yes, Al-Matbahu.
Al-Mat'bahu.
Al-Matbahu. You get it right. What about this?
As-Sayyaratu.
MashaAllah. As-Sayyaratu. What again?
As-Sayarat.
What about this?
Al-Idaratu. Al-Idaratu.
MashaAllah.
I can't see my screen.
I can't see it. I can't see it on the screen.
I can't see
Can you
that.
not see?
Sorry, the screen is not.
It's very
It's not
small.
visible.
Yeah, but I've enlarged it.
It's now it's okay now.
Al
What about this now?
Hadaratu.
Al-I.
It's gone again.
Idaratu.
Idaratu.
The screen is not stable.
Idaratu.
Eh,
You need to
It's okay now.
on your screen.
I bet you sure on it go off.
No, you need to. If you don't pin it, you need to pin his own screen. That his own screen is not visible.
Okay.
what about now?
If anybody speaks, it goes to those that speaking. But if you pin his own screen, it will be
Okay.
there permanently.
Okay.
Al-Maktabu.
Al-Maktabu.
Al-Muktabu.
We all got it right. Let's take it again.
Al-Fasl.
Al-Fasl.
Al-Faslu.
Al-Fasl.
Al-Faslu.
Al-Fasl.
Al-Faslu.
1, 2.
Al-Matbahu.
Al-Matbahu.
Matbahu.
What about this?
Al-Sharat.
As-Sayyaratu.
Sayaratu.
You can see there is shadda on ya.
Sayaratu.
As-Sayyaratu.
As-Sayyaratu.
What about this?
Al-Idaratu.
Al-Idaratu. And the last one?
Al-Maktabu.
Al-Maktabu. Thank you very much, everybody. For the last time, let's have it again.
Al-Faslu.
Okay?
Al-Matbahu.
Again?
As-Sayyaratu.
Again?
Al-Idaratu.
And the last one?
Al-Maktabu.
Al-Maktabu. I decided to bring up these things to enrich your lexicography. You put them in your own personal dictionaries that you have gained another 5 Arabic words today. With that, if you are gaining 5 Arabic words every week, in a year, you should know how many numbers of Arabic words you gain. This is how you improve your language. So don't let us give up, don't let us stop, don't let us be lazy, let us be courageous and have intention of moving on. I'll give you the meaning of this. But before giving you the meaning, let me test you. There are some among you who have read beyond the class. May I know anyone who knows the meaning of al-faslu? Before I give you my meaning.
The class.
Are we speaking with Taiwo Aderolu?
Yes, I'm answering.
Yes. What is the meaning of al-faslu?
I think it's the class.
Do you think or you believe?
I believe it's the class.
She is very, very correct.
Class.
Al-faslu means what?
The class. The classroom. The class.
The class, yeah.
The class.
Whether you call it room or not, just the class.
The sword.
The class. What makes it they? What makes this definite article is the alif and lam here. Are you there?
Yeah. Okay.
Are we all listening?
Yes, we are.
Yes, we are.
What makes it definite article? This definite article, what stands for it here is this alif and lam. If you don't want to make it a definite one, you can say faslun. You start from this far. And then you double the dhamma here. You now say faslun.
Faslun.
Means what? Class.
Class. The class.
Or a class.
Class.
So, but putting alif and lam makes it definite. That's why I have to write the
class. Class.
Do we get it right?
Yeah.
So you apply that the knowledge of alif and lam, the one you have gained here, to every other one that comes your way. Is that taken?
Yeah. Yes.
Okay, let's move on. Al-matbahu. Who knows the meaning?
Al-matbahu.
Don't check your dictionary. Try.
The kitchen.
The kitchen.
Who said the kitchen?
The kitchen. The kitchen.
The kitchen. Alaja Bello.
Alaja Bello.
Now.
How do you want me to believe that you are not checking your dictionary, ma?
No, I don't have dictionary.
Okay. And I'm very sure you can't guess and guess right.
No, I've had it before.
That's good. That's good.
Because they said
who means what?
The kitchen.
Every woman's office. Whether you like it or not, your office is in the kitchen as well.
Okay.
Unless the what? Chicken go.
Kitchen.
Kitchen.
The kitchen. The kitchen.
Al-matbahu.
We get it right?
Tabaco.
Al-matbahu. The kitchen. Somebody is saying tabakh. Who is that person, please? Someone is saying tabakh. It has a meaning. Okay, let's move on. Which one is this?
Asayara.
Asayaratu. Who knows the meaning?
Asayaratu. I raise my hand. It's the car.
Your name?
Muiba.
Alaja Muhibba.
Yeah.
What is the meaning of Asayaratu?
The car.
Okay. You people amaze me every time. I'm speaking with League of Arab Africans. African Arabs. Okay. What is this?
Al-Idara.
Al-Idaratu.
Idaratu.
And what does that mean? What does this mean?
Al-Idara. No, me.
Al-Idara. Al-Idara means, it has two meanings. One, administration.
Admin.
Yes.
That's simple. I don't know that.
Two, office. So let me give you the two meaning. Admin
or office.
Or
office.
Office. Do you get it?
Yes. Office.
Al-Maktabu.
Maktabu.
Yeah. Al-Maktabu is office.
Yes, we've said that in the last two
classes. Yes, you told us.
Yes. Al-Maktabu could mean what? It has two meanings. Two meanings.
It can be table.
A table. Table office.
I'm so happy. You don't cease to make me happy. Jazakumullah khairan. Office or
table.
Table.
Or desk.
Or desk.
Office, table, or desk.
No, desk.
Desk officer.
Desk.
So now let's begin the
class.
Sentence formation. Sentence what?
Information. Sentence formation.
We want to form sentences now. I just need someone to tell me, I am in the class. Raise up your hand. Don't rush. If you all know it, raise up your hands, all. Alaja Bello is raising up her hands. Who else? I can see Alaja Bello, and I can see Taiwo Aderolu. I can see R.M. Momotocho. Who else?
No, raise your hand. Alaja Shoten.
Alaja Bisiriyu is joining the crew. Who else?
No, raise your hand.
AO is among us. Adetutu has gone again. Oh.
No. I'm raising my hand. I
can't see again. You just left. I can see you now.
Okay.
We have more than 20 participants here. We have 6 raising up their hands. They have not gone to half of the class. Someone somewhere else, somewhere is assessing us. I just want you to give me the English equivalent, the Arabic equivalent of I am in the class. Raise up your hand if you can try, attempt. Lolade Abdul Malik has joined the crew. At least we must have half of the class. Who else? We are just 7. Not got into the half of the class. If I should assess myself with this turn up, I won't get average. Nobody else? Okay. RM Omotosho. RM Omotosho, are you in the class? Tell me I'm in the class in Arabic. RM Omotosho, are you there? I don't think he's around. Alaja Bisiriyu.
Anna le facelo.
Oh, may Allah not make you a class.
Can I correct him?
Oh, yeah, you can correct it.
I not feel the not feel.
Check again.
Anna feel facile.
I not feel facile.
Anna feel
facile. Somebody has just helped you. And who is the person speaking?
Anna feel
facile.
You know what? There are some
the facile, not facile, the facile.
If the fee,
I've make it the facile, Lily. You change it to Castro. Change it to Castro.
The fee we are talking about, if it enters into a noun, it makes it Castro.
Okay.
So Anna feel falsely.
Falsely.
Alaja Bisiriyu got 70 out of 100.
Allahu Akbar.
Allahu Akbar.
The pass, not just the pass mark. In Nigeria, 70 is A.
Allahu Akbar.
Anna feel falsely. Do we all agree?
Yeah.
Anna feel falsely. Okay, Alaji Taufik.
No.
I want you to give us the Arabic equivalent of he is in the class.
He is in the class.
Can I?
Alaji Taufik.
He's in the class.
He is in the class, yes. What is the Arabic equivalent?
Can I?
Huwa fil fasl.
Huwa fil fasl.
Fil fasl.
MashaAllah, you got it right. Alaja Adetutu. She is in the class.
Here. Feel Lily Fasili.
Again?
Yeah.
Here. Yes, here feel Lily Fasili.
Here feel Fasli. She is in the class.
Yeah.
Okay. We are in the class.
Nakno.
Who said it?
Nakno.
Alaja Bello Abi?
Nah.
Nakno.
See, today,
Fasli.
Nakno fil Fasli. Takbir.
Allahu
Akbar. Naflu.
Nakno.
It is Nahanu.
Nahnu.
Nun, ha, and nun. Nahnu. I've made Alaja Bello our female class rep.
Okay, no.
Allahu Akbar.
Allahu Akbar.
So, class rep in Arabic is Naqib.
Allahu Akbar.
For a male. What is the female class rep in Arabic?
Naqibatun.
Alaja Bello.
Now.
Are you happy to be the Naqiba?
Inshallah.
People are contesting.
No. Alaja Adetutu.
So I can make Alaja Adetutu Naqiba next week.
It's okay.
Alhamdulillah. Okay. Nahnu fil fasli means what?
We are in the class.
They are in the
class. Thank you. Are we okay with the word faslu?
Yes.
Anywhere you see it, you will not forget. But the best way not to forget is to be using it in your daily conversation. Just chip it in. Hello, my dear sister, my dear brother. Why are you not staying in the faslu? You ask you, what do you mean by faslu? Why are you not staying in the class? Thank you. That is how you can improve.
Okay.
Okay, al-matbahu.
The kitchen.
The kitchen.
The kitchen.
Yes. I want you to say, this is the kitchen.
Other.
Yes.
This is other the
this
so other topic.
Very well. Okay. Sorry. Let me say this kitchen. Just say this kitchen.
This kitchen. This other this kitchen. No, we can use motobico.
It is matbahu, now not motobico. Matbahu is kitchen. I want you to say this kitchen.
Al-matbahu.
هذا المطبخ. المطبخ.
هذا المطبخ. You know, I promise you that you have to be using the knowledge you have about. هذا المطبخ. This kitchen. هذا المطبخ. This kitchen. Are we getting it right?
If you say Azdal huwa al-matbahu, means this is the kitchen.
You are speaking an advanced Arabic. هذا هو المطبخ is not just this is the kitchen. It's not just this kitchen. This kitchen is هذا المطبخ. This kitchen.
Okay.
But هذا هو المطبخ. This is the kitchen.
This is the kitchen.
هذا هو المطبخ.
Did you get it right?
Yes, this is the kitchen.
I know.
Let us be true with one before we go to another. Our brother Alhaji is raising a very crucial argument that هذا هو المطبخ is a very correct Arabic, but it means this is the kitchen.
Kitchen.
No, you will not say he. You will not translate this as he in this context. You won't say this is he, the kitchen. No. It's more advanced than the level we are right now. But we are saying if you use it in that manner, it means this is the kitchen. But the question is that this kitchen, هذا المطبخ, this kitchen, هذا هو المطبخ, that is the kitchen, or this is the kitchen. Thank you, Alhaji, for that. I appreciate that. Okay, let's move on. I want to say, where is the kitchen?
I said it.
I am in the kitchen.
Ana fil matbah.
Ana fil matbah.
Because of fee, we
Yes.
If
you say Ana al-Matbahu, it means you are the kitchen yourself. Don't forget to use the fee. Ana fil matbahi. I'm in the kitchen.
Ana fil matbahi.
Yes. I'm in the kitchen. Is that okay?
Yeah.
Which one is this?
Sayaratu.
As-sayyaratu.
Sayaratu.
Let me call on. And the meaning of as-sayyara means what?
The car.
If I want to say a car, what would I say?
Sayaratu.
A car.
Sayaratu.
Just a car, a car.
Sayaratu.
If I say a car, you will erase this alif and lam.
Sayaratu.
Sayaratu. You double the dhamma. Sayyaratun. Sayyaratun. So a car or car. But now, as it is having alif and lam, it means the car.
And
you bought a car and you want to show it to your friend, and you are telling him or her, that is the car.
Daleka.
Okay, let me say, I've not taught you that. This is the car. Somebody is somebody said Azihi.
Because with Tamar at the end says female, so it's going to be Hazihi instead of
your name once again.
I like Taufik
Shadunke. As from today, you are the Naqib of our class. Because don't forget, I told you once upon a time that the ta at the end of a noun signifies its feminism. This is it shows that the word, the noun is for feminine. Do you agree with me?
Yes.
Yes. Somebody that is bearing Rahmatu, the ta shows she's a female.
Yeah.
Aminatu. Habibatun. Muhibbatun. Tayyibatun. Shows you are a female. But not in the case of Hamzatun. Hamza is a male, is for masculine. Abi?
Yeah.
Talha is for male as well. But in this case, Sayyaratun means a car. But this tar shows it's a feminine. Now, I want to say this is the car. Will I use either for male or Hazi for female? Which one?
Hazi.
Is for female. Other is for male. Which one would I use? Hazihi sayyaratu. This car.
Right.
Hazihi sayyara. Alaja Bello Naqiba. I am in the car.
Anna fil sayyara.
Sayyarati.
Anna fil
sayyarati.
Okay. Where is the car? Alaja Adetutu.
Aina. Where is it? Aina. Where is the car? Aina. Asayarati. Asayaratu.
Aina sayyaratu.
Yeah, aina sayyaratu. Asayaratu.
Aina Sayaratu, where is the car?
Yeah, we won't use Ali because of it's not a F.
I can't get you.
Aina Sayaratu. Sayaratu. Aina Sayaratu.
Okay, you are correct now. Where is the car? Okay, let's move on. We have gained something there. Al-Idara means what?
Office, admin, office or
or administration.
Office or administration. Now, I want you to formulate this sentence. British administration.
Let's go. British. Britannia.
Idaratun Britannia. Idaratun Britannia.
I could hear the Naqib, but there is a female who said Al-Idaratul Britannia. Who is that person?
I said it.
Al-Idaratul Britannia.
Britannia Al-Idarat.
No.
Al-Idaratul Britannia. Who among the females says or said Al-Idaratul Britannia?
I did.
No,
I also said it.
Mention your name, please.
Taiwo Aderolu.
Taiwo Aderolu got it perfectly. And whoever said so got it perfectly. Al-Idaratul Britannia, British administration. Let me write it for you. Al-Idaratu is the way you are saying it.
Administration. Okay. British liberty. Yeah.
Admin.
Britannia.
Britannia.
Al-Idaratu
Britannia.
Al-Britannia, British administration. British Al-Britannia Al-Idara. In every language, we have culture of sentence formulation. You understand? Adjective in Arabic, most times, adjective de wasiwaju ki predicate totally. You get it? You won't turn it the other way around. You won't say Al-Britannia Al-Idara. As if you are translating word for word in English. British administration. Awolowo University. You won't say Awolowo Jamia.
Jamia.
You say Jamiatu Awolowo.
Jamia.
University of Ilorin. Or Ilorin University. You won't say Ilorin Jamia.
No.
Jamiatu
Ilorin.
You can Jamiatu Ilorin. Jamiatu Ilorin. MashaAllah. So Al-Idaratul Britannia means the British what? Administration. Or the British office. If you're having a British office in your town or in your area, you say Al-Idaratu Al-Britannia. Or you say Maktabul Britannia. Maktabu.
Victoria.
Thank you so much. So with this, we have come to the end of the 5 words, 5 lexicography we promised this morning. Can somebody mention the words offhand, the 5 words we have learned about today offhand? Anybody?
Just the word?
Just the word.
Al-Fasli. Al-Matbah.
Okay.
As-Sayara.
Okay.
Al-Idara.
Okay.
Al-Maktab.
Al-Maktab, mashallah. Yeah, mention them and their meanings.
Al-Fasli.
The class.
Al-Faslu, the class.
Al-Bahu, the kitchen.
Al-Matbahu, the kitchen.
Sayaratu, car.
The car.
Idaratu, office or administration.
Okay.
Al-Maktabu, desk or table.
Desk or
table.
Table.
Or office.
Alaja Bisiriyu.
Yeah.
Mention them offhand.
Al-Fasl.
Yes.
The okay. Let me start again.
Nakiba. Alaja Bello will challenge you. Adetutu will also challenge you.
Okay.
Yeah, move
on. Al-Fasl, the class.
Yes.
Al-Matbahu, the kitchen.
Okay. Yes.
Al-Sayaratun, the car.
Okay.
Al-Idaratun, the office or administration.
Okay.
Al-Maktabu, the table or office.
A round of applause. Alaji Taufik, please. Alaji Taufik.
I'm just sorry, the customer. Just 1 second, please.
Okay. Let me call on Alaja Musa.
Nam, I'm a beginner.
I just say something. You are not just training.
Yeah, I'm observing today, so this is my first day today. I just want to see what they're doing, and inshallah, I will pick it up.
As your son, what if I ask you, Mommy, what have you been listening to?
I've been listening to very educative Arabic words that, you know.
Did you gain any words, Mommy?
Again, Al-Faslu.
Yes. What's the meaning? What's the meaning, Madam? Alaja Musa?
I think that's kitchen.
Class. The class.
A class.
It is because you cook very well. Al-Faslu means what? Class.
Class. Okay, class. Al-Faslu.
You know, we are in a class now. Virtual class. We are in Faslu. Thank you for even trying to give us at least a word. Let me call on.
Yeah, I have asked for the beginner so I can join that one, inshallah.
I can see Malama Ajia. Okay, Abdulrasheed. Abdulrasheed. Okay. Abdulrasheed is not. Amina Salahu. Who is Amina Salahu? Are you there?
I'm there. I'm very sorry. I've not been following every week. I've only come in. I mean, not really. It's like my third time of joining, but I've not been fully starting from the beginning. But I can remember Al-Faslu.
And what is that?
The office.
The office.
Yes.
What about the female's office? The natural office where you serve your husband, where you do things.
Oh, yes, the kitchen. The kitchen, but I can't remember the Arabic form of it.
Al-Matbahu.
Al-Matbahu.
Okay, Al-Matbahu, okay. Al-Matbahu.
I have a question for you.
Al-Matbahu.
Yes, please.
Do you can you identify Arabic letters?
Yes.
Okay.
Inshallah.
Inshallah. So when I say Al-Matbahu, you should know the alphabets that make it.
Yeah. Yes.
Can you try?
Al-Matbahu.
Alif.
Alif Fatia.
Just continue.
Mim.
Yes. Something is missing.
Lam.
Yes. Before mim.
Lam. Mim. To.
Yes.
Oh.
After to, what? What is?
Ba.
Ba.
Yeah.
And what?
Is it wow or doma?
Is al-matbahu.
Al-matbahu. That's ha. Who?
Takbir for her.
Allahu Akbar.
Allahu Akbar.
We appreciate Alhaja Salahu. Let me
Alhamdulillah.
call on.
I appreciate you.
Let me call on. Be just Fab 1. Be just Fab 1. Who is Be just Fab?
Assalamu alaikum.
Wa alaikum salam. What have you learned so far in this class?
Al-Fasil class.
And the meaning?
Class.
What else?
Al-Matbahu.
Al-Matbahu, meaning? Kitchen. What else?
I'm trying to remember the administration one.
Al-Idara.
Al-Idara. The car.
The car. What is the car in Arabic?
Sayyara.
As-Sayyara. Thank you. But you are not a first timer.
I am.
Oh, that's good. Lovely. Takbir for her too.
Allahu Akbar.
Allahu Akbar. Bola Fetuga.
She went to night duty.
How are you? Bola Fetuga, please. It's your turn to shine. Hello. She's not with us. Let me call on Ibrahim Oyedele. This is a regular man. Ibrahim Oyedele.
Nah.
You are welcome. What are those 5 words? Or you can remember any 3 of them.
Al-Faslu, Al-Matbahu, As-Sayyaratu, Al-Idara, Maqtabat.
And their meanings?
Al-Fasl, class or classroom. Al-Matbahu, the kitchen. As-Sayyaratu, the car. Al-Idara, administration, management or office. Maktaba, office.
Takbir for Alhaji Ibrahim.
Allahu Akbar.
Conveniently, he answered them all. Mustaqim Ibn Ahmad Bello. Mustaqim. Are you with us? Mustaqim is not with us. Okay, yeah. Do we have Yaya in the room?
Yeah.
Aji Ashokumbi. Aji Ashokumbi is not around with us. Okay, let's move on to the Quran class. Alhamdulillah for the Arabic today.
You didn't call me.
Oh, what's the name, please?
Hamdalat, A.O.
Hamdallah, A.O. I'm sorry. What are those 5 words we taught today? You are taught today, and their meanings.
Al-Faslu, class.
What again?
Faslu. Al-Faslu.
Yes, class.
Al-Mutba'u, kitchen.
Al-Matbahu, the kitchen.
Al-Matbahu.
Okay.
Yes. Al-Sayaratu, car.
Yes.
Al-Idara.
Okay.
Admin of
okay.
Table and decks.
MashaAllah. Takbir for her.
Allahu Akbar.
Can you use any of them in a sentence?
Yacht.
Okay, try. Hamdallah.
I'm going to use driving the car. I just want to try if I get it right. We haven't mentioned it though. So
yes.
I'm going to say Yakdu al-Sayara.
Again, please.
Yakdu al-Sayara 2. Is that driving the car?
No.
What's the meaning of Yadu?
Yeah, you go.
Let us benefit from you, please.
I wanted to use the word driving, so you can correct wrong.
What is the word driving? What is the word you use for driving? Let me hear it clearly, please.
I think it's because I've heard it before. I'm not quite sure if it is right or if I'm saying it right, but I believe Yakdu, something along that line.
Okay. Yaqudu.
Yaqudu, yeah.
Yaqudu Sayyara.
Sayyara.
But that's not the appropriate word.
Okay.
Yaqudu Sayyara means is directing the car.
Okay.
It is Yasuku.
Yasuku Sayyara.
Yasuku Sayyara. He is driving the car.
Yasuku.
And a driver is Asaiq.
Sayyara.
Yasuku. A driver is what?
Sayyara.
Asaiqu.
Can you write it out?
Can I write it?
Are you able to write it out, please?
Asaiqu.
Yasuku.
Which one do you want me to write?
Like
driver.
Yasuku.
Driver.
Yeah, driver and
Sayyara.
Please, thank you.
Where is driving?
He's driving the car.
Yasuku.
Yakudu.
Yakudu.
Yakudu means is directing.
Yakudu is directing.
Is driving.
To go another level.
Can you close the play?
Don't worry, I'll do that.
Thank you.
You're welcome. What is this?
Iku.
Asaiku. Driver.
Asaiku.
Asaiku.
Asaiku. Driver.
The driver. But he is driving the car. You can say huwa he. Yasuku. Driving. As-sayyara.
Yasuku sayara.
Sayyarata.
Huwa.
Huwa he Yasuku is driving as-sayyarata, the car.
This is driving a car.
So what if you are driving the car? If you want to say I am driving the car, Anna Asuku, you change this year to Alif.
Can I say Anna Yakudu?
Anna.
What did you say?
Can I say Anna Yakudu?
La, you can't say that.
Anna Yasuku.
Because that's the year you said is referring to E.
Okay.
Anna Asuku. This Alif is referring to you.
Okay. Anna Asuku Sayara.
I am driving a car. I'm driving the car. Huwa yasuku, ana asuku, nahnu nasuku. This is another class entirely. Nahnu nasuku, hum yasukun. Hum. They. Yasukun. They are driving. We'll soon get to this class. After the conversation, we'll get into what is it called? Morphology and syntax. Morphology and syntax.
Anna, please, how do I say I have a car? I have a car?
Indi Sayyara.
India.
Indi.
Indi.
This has 2 meanings. You can say Indi Sayyara and you mean you have a car. You can say Indi Sayyara and you mean a car is with me.
Indi Sayara.
And you can say Liya Sayyara, but Liya Sayyara is the original meaning for I have a car.
Liya.
Liya. For me, a car. Liya means for me.
Liya Sayara.
We all get it right?
Yes.
Liya Baytun. What's the meaning of Liya Baytun?
I have a house.
I have a house.
Baytun, yeah, I know that.
Yes. Liya Matbahun.
Liya, I have a kitchen.
I have a kitchen.
Liya Zawjun.
Liya Zawjun.
My spouse.
I have a
spouse.
The spouse.
Spouse.
I have a husband.
Spouse.
Liya Waladun.
I have a son. I have a son.
A son.
A son.
Liya Bintun.
I have a daughter.
I have a
daughter. Do we all get it right?
Yeah.
Is there any other person we have not called before we move to Quran?
Shukran.
Jazakallah khairan. Shukran means thank you.
Jazila.
Aha. Jazila means abundance. Thank you in abundance. Or very much. Alhamdulillah. GNS, that's general language of the hereafter. Okay. Are we ready for Quran?
Inshallah. Yes.
We were able to finish the first 5 verses of Surah Al-Baqarah, Quran chapter 2, last week. Today, we are starting from the 6th verse. Verse 6. This table is filled up. Alaja Bisiriyu, you are raising up your hand.
Me? No, that was the one I raised before I answer question.
Okay. Can we all see?
Yeah.
Bismillah ar-Rahman ar-Rahim. Let's try. What is this?
Not very clear.
It's gone up.
They are not seeing it too.
It's not on the screen.
You have to pin the screen.
Okay.
Sorry,
You
what
double
chapter?
click.
Quran 2. Surah 2. Surah Baqarah 2. Surah 2.
Sideways now. It's sideways. We can't see.
You can see? Can you see?
No, it's upside down.
It's sideways.
It's sideways.
Side.
Yes, we can see.
Yeah. Yeah, we can see now.
No.
Blurry now.
No.
That's blurry, yes.
No, I can't.
That's better.
I can't see it.
I can't.
I can't see myself. It's not on the screen.
No.
Perfect now.
You have to pin his screen by double clicking his
screen.
Okay. It's gone again.
It's going off again.
Oh yeah, let's read it.
What about this?
It's not showing here.
It's not showing.
It's perfect now.
It's showing.
It's showing. What happens is on your screen, you're on the single screen. If somebody talks, the person that's talking comes on the screen. So to see him permanently, you need to swipe to the other screen, and that will show you 4 grids. So it will be on that 4 grid.
So how do we do that?
Okay.
Exactly. You have to swipe to the left.
Okay.
And when you're on his screen, double click. Just double tap on his screen, then it will pin his.
Okay, I got it.
Oh, yeah. My screen is not. It's only when somebody is speaking, I see.
Yeah. Go to the left. Aja Musa. Click on the left.
Swipe left.
Swipe to the left.
What are you trying to do?
No, it's showing now. Okay, it's showing now.
And you double click on
the... Can we move on?
Yeah.
Now.
Bismillah ar-Rahman ar-Rahim. What is this?
Inna.
Lazina.
Lazina.
Kafaru. Sawa'un. Alayhim.
Anzaltahum.
It's blurry.
Yes.
It's better now. Yes.
It's better.
Anzaltahum.
Anzalna.
Anzartahum. Anzartahum.
Anzartahum.
Tahum.
It's blurry.
Blurring.
Lam.
Amlam.
Oh.
Why is it doing that?
Tunsirihum.
I want us all to participate.
Tunsirihum.
Do we agree?
Yes.
Yeah, it would be nice, but it's blurry.
It's better now.
Rohum. Rohum.
La
Yuminun.
For those that are just beginning today. Okay.
Atama.
Is it Atama or what?
Atama.
Khatama.
Khatama.
Allah.
Kulubihim. Wa ala sam'ihim. Wa ala absarihim.
Absorihim. Shawatun.
Walahum. Azabun.
Azimun.
Yakulu. Amanna billahi wa yawmi is blurring.
It's blurring.
Wa bil yawmi.
Sorry, please.
It's better. Wa bil yawmi.
Yaumil akhiri.
Wa ma bimu'minina.
Yuhadi'una.
Again.
Yuhadi'una. Law. Walazina. Amanu. Wama yada'una. Ama yada'una. Ila anfusahum. Wama yashuruna.
Sheikh, 5 more minutes, please, Sheikh.
Fi qulubihim maradun fasadahum.
Hum.
Umullahu.
Umullahu.
Maradan.
Marathon.
Marathon.
Maradan.
Marathon.
Maradan.
Don.
Maradan.
Walahum.
Azabun.
Azabun.
Alimun.
Alimun.
Bima.
Kanu.
Yaksibun.
Takbir.
Allahu Akbar.
I'm happy we are moving higher. We are getting more to advanced level. Now we are able to recite another 5 verses today, making 10 verses of Surah Al-Baqarah, Quran chapter 2. Are we progressing?
Yes. Alhamdulillah.
Now listen to my own recitation and be following your Quran. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. إن الذين كفروا سواء عليهم أأنذرتهم أم لم تنذرهم لا يؤمنون. ختم الله على قلوبهم وعلى سمعهم وعلى أبصارهم غشاوة ولهم عذاب عظيم. ومن الناس من يقول آمنا بالله وباليوم الآخر وما هم بمؤمنين. يخادعون الله والذين آمنوا وما يخدعون إلا أنفسهم وما يشعرون. في قلوبهم مرض فزادهم الله مرضا ولهم عذاب أليم بما كانوا يكذبون. صدق الله العظيم.
الله أكبر.
الله أكبر.
الله أكبر.
أكبر كبير.
جزاكم الله خيرا. And that was the little we can offer today in our Arabic stroke Quran series. Do we have any question before we leave the floor for the moderator? Any question, please? Any question?
I heard Elijah Musa was asking that how can they catch up? What can, is there any?
For the beginners.
I would like her to speak with the proprietors.
Okay.
Assalamu alaikum.
Wa alaikum salam to Allah.
We have a WhatsApp group. If you join the WhatsApp group, then there's a link to the videos that we have done before. You can use that, and you have the opportunity to ask our tutor. Is on the WhatsApp group as well, so we will be able to support you. I will send this WhatsApp group now.
Okay, all right.
Inshallah.
You will send WhatsApp.
Any other question before? Okay.
Yes, I have a question.
Thank you.
Assalamu alaikum. Yeah, my question is in the Arabic section. You know, when you were saying in the Sayaratu, whatever, if you say Sayarati, how is that different from in the Sayarati?
Sayyarati is my car. When I say Sayyarati, I mean my car. But Liya Sayyara, I have a car. Indi Sayyara, I have a car and I am with a car.
Okay. Okay.
You got it?
Yes.
Thank you. I mean, any other one? Sheikh Abdulwaheed, I think you have the floor.
Jazakallah khairan jaza ya Sheikh for another educative session today. Very moving and very inspirational. May Allah subhanahu wa ta'ala continue to shower his rahman, keep him upon you, and we pray to continue to have you with us, inshallah, to continue to benefit from your knowledge. So as we've been posting in the chat, inshallah, we will be starting for beginners, for those that wants to learn from Ali. We did start this. This is how the Arabic sort of started, but in terms of the Quranic scripts reading, inshallah, we will start with that next week, from the next week session. So that will be like a half an hour session from 10:30 to 11, inshallah, after the original Arabic and Quranic. So that will go through the script itself and the joining, like just learning how to recite the Quran, inshallah ta'ala. So it won't be today. If that was misleading, apologies. That will be from next week, inshallah. And so yeah, we hope once again you've enjoyed today's session and you've learned a thing or two. We hope you can join us again from next week. So for those that don't know or that are new to the platform, this is held every Saturday morning from 9 a.m. until 11-ish a.m., where we go through the Quranic, and we've been having this for the past 5 weeks with our Sheikh Dr. Mahmud Danjumah Musa, who is a senior lecturer at University of Ilori within the Department of Arabic. So he's very knowledgeable, very experienced, and so you're in good hands. Alhamdulillah Rabbil Alameen. So I'd like to call on our Sheikh to give us the closing dua for today.
Jazakallah khairan, Ustad Abdulwaheed.
Yeah.
Jazakallah khairan once again. May Almighty Allah be with you. May He always guide you and guard you.
Amen.
Thank you for the wonderful job, for the patience you are going through. And there is no any other reward for patience but Al-Jannah. May He make you a dweller of Al-Jannah.
Amen.
And as we have prayed for you, may He make us dwellers of Al-Jannah as well.
Amen. Amen.
For the closing prayer, let us focus our mind and zero it as if we are standing before Almighty Allah. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. ربنا تقبل منا إنك أنت السميع العليم وتب علينا يا مولانا إنك أنت التواب الرحيم واهدنا ووفقنا إلى الحق وإلى طريق مستقيم ربنا هب لنا من أزواجنا وذرياتنا قرة أعين واجعلنا للمتقين إماما ربنا أفرغ علينا صبرا وثبت أقدامنا انصرنا على القوم الكافرين ربنا لا تدع لنا في مقامنا هذا ذنبا إلا غفرته ولا هما إلا فرجته ولا دينا إلا قضيته ولا مريضا إلا شفيته ولا كربا إلا نفسته ولا عسيرا إلا يسرته ولا مبتليا إلا عافيته ولا جاهلا إلا علمته ولا ناصبا إلا نجحته ولا فقيرا إلا أغنيته ولا غنيا إلا زدته حاجة من حوائج الدنيا والآخرة إلا قضيتها يا أرحم الراحمين ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار ربنا مسلمين والحقنا بالصالحين اللهم ارزقنا بقول لا إله إلا الله محمد رسول الله صلى الله عليه وسلم سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك سبحان ربك رب العزة عما يصفون سلام على المرسلين والحمد لله رب العالمين.
آمين.
صلوا على النبي.
Jazakallah khairan jaza to everybody for attending today. May Allah subhanahu wa ta'ala reward us for the opportunity as well as for the effort that we're making in learning better of our deen and try to acquire that knowledge. May He benefit us in this world and in the hereafter. Inshallah. So once again, assalamu alaikum wa rahmatullahi wa barakatuh. May we have a better weekend.
We thank you so much. Thank you very much.
We hope to see you again next week, inshallah.
I appreciate it.
Afwan.
Thank you.
MashaAllah.
MashaAllah.
Are we in question and answer time now?
Yes, what did you say?
I said, are we in question and answer now?
Oh, okay.
We have 1 minute to go. If you can have a question.
So actually, it was a contribution about the COVID that my sister said about. I just want to say that, I mean, it's good to have it, but don't let us be fooled about the expectation. It's not, I mean, what the study has shown is not to prevent, so to say. The test just showed that those that had it, when they didn't have COVID, it wasn't that serious. That is what it's all about. And it's just, I mean, we should not have too much expectation. The key is to still keep the social distancing, wearing the mask when appropriate, wash your hand regularly. The thing we are asked to do, that is the key to prevent the spread of this COVID. The vaccine is good, by all means take it, but it's not the magic bullet everybody is expecting. The study does not show that it stopped from getting it. It only says that 95% or 90% of people that got it was not serious, which is the case anyway that we have now. So the best is to prevent yourself from having it, social distancing, wearing your face mask, and washing your hands as often as possible.
Thank you for the information. Very beneficial. May Allah reward you. Jazakallah khairan.
Barakallahu fikum.
Amin wa iyyakum. Okay. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
لتؤمنوا بالله ورسوله وتعزروه وتوقروه وتسبحوه بكرة وأصيلا إن الذين يبايعونك يد الله فوق أيديهم فمن نكث فإنما ينكث على نفسه ومن أوفى بما عاهد عليه الله فسيؤتيه أجرا عظيما سيقول لك المخلفون من الأعراب شغلتنا أموالنا وأهلنا فاستغفر لنا يقولون بألسنتهم ما ليس في قلوبهم قل فمن يملك لكم من الله شيئا إن أراد بكم ضرا أو أراد بكم نفعا بل كان الله بما تعملون خبيرا بل ظننتم أن لن ينقلب الرسول والمؤمنون إلى أهليهم أبدا وزين ذلك في قلوبكم وظننتم ظن السوء وكنتم قوما بورا ومن لم يؤمن بالله ورسوله فإنا أعتدنا للكافرين سعيرا ولله ملك السماوات والأرض يغفر لمن يشاء ويعذب من يشاء وكان الله غفورا رحيما سيقول المخلفون إذا انطلقتم إلى مغانم لتأخذوا خذوها ذرونا نتبعكم يريدون أن يبدلوا كلام الله قل لن تتبعونا كذلكم قال الله من قبل فسيقولون بل تحسدوننا بل كانوا لا يفقهون إلا قليلا قل للمخلفين من الأعراب ستدعون إلى قوم أولي بأس شديد تقاتلونهم أو يسلمون فإن تطيعوا يؤتكم الله أجرا حسنا وإن تتولوا كما توليتم من قبل يعذبكم عذابا أليما ليس على الأعمى.
This year has been one of humanity's worst.
ما حرج ولا على الأعرج حرج ولا على المريض حرج ومن يطع الله ورسوله يدخله جنات تجري من تحتها الأنهار ومن يتولى يعذبه عذابا أليما لقد رضي الله عن المؤمنين إذ يبايعونك تحت الشجرة فعلم ما في قلوبهم فأنزل السكينة عليهم وأثابهم فتحا قريبا ومغانم كثيرة يأخذونها وكان الله عزيزا حكيما وعدكم الله مغانم كثيرة تأخذونها فعجل لكم هذه وكف أيدي الناس عنكم ولتكون آية للمؤمنين ويهديكم صراطا مستقيما وأخرى لم تقدروا عليها قد أحاط الله بها وكان الله على كل شيء قديرا ولو قاتلكم الذين كفروا لولوا الأدبار ثم لا يجدون وليا ولا نصيرا سنة الله التي قد خلت من قبل ولن تجد لسنة الله تبديلا وهو الذي كف أيديهم عنكم وأيديكم عنهم ببطن مكة من بعد أن أظفركم عليهم وكان الله بما تعملون بصيرا هم الذين كفروا وصدوكم عن المسجد الحرام والهدي معكوفا أن يبلغ محله ولولا رجال مؤمنون ونساء مؤمنات لم تعلموهم أن تطؤوهم فتصيبكم منهم معرة بغير علم ليدخل الله في رحمته من يشاء لو تزيلوا لعذبنا الذين كفروا منهم عذابا أليما إذ جعل الذين كفروا في قلوبهم الحمية حمية الجاهلية فأنزل الله سكينته على رسوله وعلى المؤمنين وألزمهم كلمة التقوى وكانوا أحق بها وأهلها وكان الله بكل شيء عليما لقد صدق الله رسوله الرؤيا بالحق لتدخلن المسجد الحرام إن شاء الله آمنين محلقين رؤوسكم ومقصرين لا تخافون فعلم ما لم تعلموا فجعل من دون ذلك فتحا قريبا والذي أرسل رسوله بالهدى ودين الحق ليظهره على الدين كله وكفى بالله شهيدا محمد رسول الله والذين معه أشداء على الكفار رحماء بينهم تراهم ركعا سجدا يبتغون فضلا من الله ورضوانا سيماهم في وجوههم من أثر السجود ذلك مثلهم في التوراة ومثلهم في الإنجيل كزرع أخرج شطأه فاستغلظ فاستوى على سوقه يعجب الزراع ليغيظ بهم الكفار. وعد الله الذين آمنوا وعملوا الصالحات منهم مغفرة وأجرا عظيما.